Hello, my name is Larissa Piton, and my project was Opioid Use Disorder, a retrospective analysis in Lawton, Oklahoma. Opioid use disorder is a chronic relapsing condition that does fall within the scope of practice of family physicians. Opioid use disorder treatment is important due to the number of deaths continuing to occur in the USA. Opioid-involved overdose deaths rose from 49,860 in 2019 to 81,806 in 2022, with a significant decrease to 79,358 in 2023. This is in no way a small number of lives lost. Opioid use disorder can be fatal, with mortality rates 110-fold higher than in the general population. The recommendations that patients with opioid use disorder should be offered maintenance treatment with pharmacotherapy is evidence rating A per AAFP guidelines. Discontinuing pharmacotherapy increases the risk of relapse in opioid use disorder. Opioid use disorder is also far-reaching among ages, sex, and race. In 2021, an estimated 2.5 million adults had past year opioid use disorder. Among them, 52.5% were men, 67.4% were age 35 or older, and 60.6% were non-Hispanic whites. Overall, untreated opioid use disorder is a chronic condition that poses a significant threat to the lives of those who have it in our community. In July 2020, the Lawton Community Health Care System Family Medicine Residency initiated office-based treatment for opioid use disorder. In 2023, federal elimination of the X waiver required for buprenorphine prescribing reduced regulatory barriers to treatment access. The purpose of this quality improvement project was to conduct a retrospective analysis of opioid use-related visit volume from July 2020 through January 2025 in order to evaluate growth, assess utilization functions, and identify opportunities to improve access to opioid use disorder in Lawton, Oklahoma. Identifying the number of patients we are treating for opioid use disorder will help reveal key program setbacks and/or weaknesses and how we can continue to improve and provide care in the community for Suboxone treatment. Treating those for opioid use disorder improves the lives of those in our community and is part of the osteopathic tenets of mind, body, and spirit. This project involved a retrospective analysis review of electronic clinical data within the ECW electronic health record. This is coded for opioid use disorder and Suboxone use disorder between 2020 and 2025 will be identified and counted. Annual totals were also obtained. Findings were examined within a strategic framework to evaluate project capacity and treatment barriers. Costs include running our residency clinic, consent in patients receiving treatment at our clinic. The project involved analysis of existing clinical data reported in aggregate numerical form without direct or indirect patient identifiers. No protected health information was recorded or reported. As such, this initiative qualifies as a retrospective quality improvement project utilizing de-identified data and does not require individual patient consent. What our data showed in retrospective analysis was the number of visits to the clinic for opioid use disorder between January 1, 2020 and December 31, 2025. There was a clear trend of increasing the number of visits for the disorder by year. Notably, from 2023 to 2024, the number of visits to residency clinic doubled. This is in conjunction with the removal of the X waiver. This increase in opioid use disorder visits likely reflects expanded treatment access and reduced prescribing barriers. Continually, word of mouth in our smaller community of Lawton could be a significant contributor to increased patient visits. These results will inform future QI initiatives aimed at strengthening clinical capacity and expanding evidence-based opioid use disorder care in the community. As expected, the elimination of the X waiver in subsequent years helped increase the number of patients treated at the residency clinic. As you can see on my poster presentation, in 2020, there was 35 visits to the residency clinic for opioid use disorder. In 2021, that number significantly increased to 202 and then held steady in 2022 to 314. In 2023, we had 476 visits for opioid use disorder. And in 2024, we had 906 visits, which was double the previous year. This is most likely due to the elimination of the X waiver. And then in 2025, there was 1103 visits to the clinic for opioid use disorder or substance use disorder. Thank you so much for taking the time to see my project, and a special acknowledgement of my program director, Dr. Mercedes Bernard, and my associate program director, Dr. Gretchen Stroud, for helping with this project. Thank you so much. Have a blessed day.